If you're an older man and you masturbate, I need to ask you something. Have you ever wondered whether it's genuinely healthy to continue this practice after the age of 50 or 60? Or maybe you've quietly worried that you could be causing yourself some kind of hidden harm. If so, you're far from alone. This subject is surrounded by confusion, outdated myths, and a clear lack of reliable, straightforward information. It's one of the most common yet rarely discussed concerns for men in their later years. And when you look at the available research, it's easy to understand why there's so much uncertainty. Studies show that while most men over 60 still engage in self-pleasure, many do so in private, unsure about the real effects on their hormones, their prostate, or even their sexual performance with a partner. That's why today we're going to have an honest, science-based conversation. I'm going to walk you through 10 surprising benefits of masturbation in maturity, and then, just as importantly, 10 potential risks you should be aware of to make sure your practice stays healthy. Let's begin with the positives. First, masturbation helps maintain penile health. Achieving an erection increases blood flow to the spongy tissues of the penis, known as the corpora cavernosa. Think of it as a form of physical therapy. This regular exercise helps maintain tissue elasticity, which is essential for strong erections as you age. Second, it promotes prostate health. This is significant. Multiple large studies, including a landmark one from Harvard, have linked frequent ejaculation to a notably lower risk of prostate cancer. The prevailing theory is that regular ejaculation helps flush out potentially harmful substances from the prostate ducts. Third, masturbation strengthens the pelvic floor. The rhythmic contractions during orgasm engage important pelvic floor muscles like the pubococcygeus. A strong pelvic floor is vital for erectile function, ejaculatory control, and preventing urinary incontinence, which becomes more common with age. Fourth, it reduces the stress hormone cortisol. In our high-stress world, this is an amazing built-in benefit. Research shows that orgasm leads to a significant drop in cortisol levels. Lower cortisol helps regulate blood pressure and reduce anxiety, making masturbation a natural tool for cardiovascular and mental health. Fifth, it releases a cocktail of feel-good neurochemicals. Orgasms flood the brain with dopamine, the pleasure molecule, and oxytocin, the bonding hormone. This natural mood boost creates a sense of well-being and emotional connection, which is invaluable for mental health. Sixth, it aids in self-detection of physical issues. Regular self-pleasure makes you more familiar with your own anatomy. This awareness is one of the most effective ways men notice early signs of conditions like testicular cancer, penile fibrosis, or other abnormalities that might otherwise go unnoticed. Seventh, it improves sleep quality. After orgasm, the release of hormones like oxytocin and prolactin, along with a drop in cortisol, creates a powerful sedative effect. This helps the body relax and makes it easier to fall into restorative deep sleep, which often becomes harder with age. Eighth, it enhances overall pelvic blood circulation. Masturbation doesn't just improve blood flow to the penis, but throughout the entire pelvic region. This benefits the bladder, prostate, and surrounding muscles, helping prevent issues related to poor circulation. Ninth, it can serve as a training method for ejaculatory control. For men who struggle with premature ejaculation, masturbation provides a private space to practice techniques like the stop-start method. This helps you better understand your body's signals and build greater control, which can translate to improved partnered sex. 10th, it keeps your sexual desire and neural pathways active. The brain is the largest sex organ. By regularly engaging in sexual fantasy and stimulation, you keep the neural circuits associated with desire and arousal firing. This helps maintain a healthy libido and sexual responsiveness, even if you don't have a regular partner. But to have a complete picture, we can't just focus on the positives. Healthy practice requires conscious awareness. So let's talk about 10 potential risks or negative effects you should watch out for. The first risk is social isolation. This becomes an issue when self-pleasure replaces healthy social or sexual interaction rather than complementing it. The solution is to ensure masturbation supports your life, not causes you to withdraw from it. Second is the risk of skin microlesions. This typically happens if masturbation is too aggressive or done without adequate lubrication. Tiny tears can cause irritation, inflammation, and even increase the risk of infection. The fix is simple. Always be gentle and use a quality water-based lubricant. Third is desensitization. If you always stimulate yourself in the same way, with the same pressure and rhythm, your brain can become conditioned to only that specific touch. This can make arousal or orgasm with a partner more difficult. The key is to vary your technique, rhythm, and focus. Fourth, it can mask underlying causes of erectile dysfunction. If you can only achieve an erection during masturbation, but not with a partner, it might be tempting to ignore the issue. However, this could be masking serious health problems like heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it's important to see a doctor. Fifth, nerve compression from poor posture. Many men masturbate while sitting in a hard chair or hunched over, which can compress the pudendal nerve in the pelvis. Over time, this can lead to genital numbness or pelvic pain. The ideal is to practice in a relaxed, comfortable position, such as lying down with proper support. Sixth, masturbation can become an unhealthy emotional escape mechanism. Using it as your only tool to cope with stress, boredom, or frustration can create a behavioral dependency. It's important to have a diverse toolkit for managing emotions, including exercise, meditation, and talking with others. Seventh is the feeling of guilt and shame. Many men were raised with strong cultural or religious taboos about self-pleasure. If these feelings persist and cause distress, it can be very helpful to speak with a sex-positive therapist or counselor to reframe this natural practice in a healthier way. Eighth is pelvic congestion. While infrequent ejaculation is a risk factor for prostate issues, excessively frequent ejaculation, multiple times a day over long periods, can sometimes cause a feeling of heaviness or aching in the testicles and pelvic area. The solution is moderation. Listen to your body's signals. Ninth, potential impact on semen quality. This is only a concern if you and a partner are actively trying to conceive. While it doesn't harm long-term fertility, ejaculating daily can temporarily reduce sperm concentration. For optimal quality, studies suggest abstaining for 2 to 5 days. 10th, disconnection from reality, often linked to pornography. If masturbation relies heavily on extreme or unrealistic porn, it can skew your expectations and make it harder to connect with a real-life partner. The key is to balance any visual aids with your own imagination and memories of real experiences. As you can see, masturbation after 60 isn't simply good or bad. It's a tool, and like any tool, its effects depend on how you use it. The secret ingredient is always conscious awareness. Practice with respect for your body, moderation, and mindfulness. It can be a powerful ally for your health and vitality. I hope this conversation was helpful. I genuinely love to hear your thoughts. What surprised you the most today? Leave a comment below, and let's keep this important discussion going. If you found value in this video, please like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit the notification bell so you won't miss our next conversation. Stay healthy, and I'll see you in the next video.